Hi, everybody. Welcome. My name is Kerith Conron. I'm the research director at the Williams Institute at UCLA, and very pleased to welcome you today to our panel, LGBTQ People and Gun Violence, Threats and Strategies to Promote Safety. I'm pleased to be joined by several wonderful panelists, Kate Reese, who's a research associate at Everytown for Gun Safety, Mallory Jenna Robinson, who's the creator of A Hateful Homicide and associate program director at Equality California, formerly. Gabriela Rodriguez, who is the executive director of Q Latinx, and Cuco Rodriguez, who is the chief strategist for racial equity at the Hope and Heal Foundation, who will serve as a moderator. So today we're going to share with you some new data about LGBTQ people and guns. Then we're going to follow with a panel discussion moderated by Cuco, and then we will have a few minutes at the end for audience questions. At the second hour, folks who'd like to join us for breakout group discussions will have the opportunity to click on a link that will take us to another Zoom space, and we'll have discussions about research and data gaps, and another one about policy and gun prevention policy. So I want to start by taking a moment. We are now 8 years and 1 day after the anniversary of the Pulse nightclub shooting, where 49 people were killed by gun violence and 53 others were wounded by gun violence. And we're also near the 2-year anniversary of the Club Q shooting, where 5 people were killed by gun violence and another 19 were injured. So I'd like to take a moment of silence to acknowledge the loss of life for people who are part of our communities. Thank you. I think we can honor the people who have lost their lives by spending our time today thinking about how we can prevent homicide and suicide in California and in the nation as a whole. I'm going to give you some data about suicide and homicide in California, and then some information about gun violence in the state of California. In 2020, there were 4,143 suicides, about a third of which were committed by firearms. Many victims were men. 2/3 of suicides occurred at home. Half of people had a current diagnosed mental health problem, and more than a third had a history of suicide thoughts or plans. When it comes to homicides, there are about 2,206 lives lost due to homicide in 2022, the majority of which were committed by firearm. Again, many victims were men, about a third were Black, which is disproportionate in the state of California to the percentage of our population is Black. 40% of homicides occurred on the streets or sidewalks in public places, and about a third occurred at home. While many male victims are killed by strangers, about half of female victims were killed by family members. These are general statistics. We actually don't know how many of these folks were LGBTQ, or if patterns of violence, self-directed or other directed, are similar or different for LGBTQ people, which is one of the topics we'll discuss today. In terms of gun-related mortality in California, gun deaths are sort of split relatively 50-50 between suicide and homicide. Gun deaths and injuries cost the state of California almost $42 billion a year, of which $1 billion is paid by taxpayers. And thank you to Everytown for calculating these estimates. In the US, we know a little bit about gun ownership and LGBT people. We know that LGBT adults are less likely than straight adults to have a gun in their home. We do know that suicide attempts are much higher among LGBT people than non-LGBT, that intimate partner violence impacts LGBT people like everyone else at similar or sometimes higher levels, and that LGBT people are disproportionately impacted by hate crimes. In the state of California, we have about 2.9 million LGBT adults, about 9% of the adult population. Folks are concentrated where the rest of the population is concentrated, in the LA County area, in the Bay Area primarily. So there are lots of people in the state of California, but little information about gun ownership and safety, as well as intimate partner violence that could help us inform prevention efforts in the state. We had the opportunity through a grant from the RAND Foundation to analyze data collected on the California Health Interview Survey. CHIS is a great resource that everybody can access through what I call a data wiki called Ask CHIS, and we'll make sure we mention that again at the end of our panel. CHIS has a sample of over 20,000 households per year. The surveys are conducted in multiple languages. We use data gathered in 2021 and 2022 for this project. The weighted sample represents California adults ages 18 and up living in households. CHIS has been collecting information about sexual orientation identity now for almost 21 years, and gender identity since 2015. So it's a great source of information about the well-being of LGBT people. So I'm going to show you a little bit about the demographic composition of the LGBT adult population in the state of California. More than half of LGBT adults are under the age of 35. We have a diversity in terms of our community being cis women, cis men, and trans folks. We are more than half bisexual in terms of the adult LGBT population in California. We are a racially, ethnically diverse population, particularly in the state of California. More than half of adults, LGBT adults, are people of color. So in terms of firearms and households, we see that gun ownership in the state of California is lower than what we see in the nation as a whole. But again, LGBT people are somewhat less likely than non-LGBT people to have any firearm in their household. And 1% of both LGBT and non-LGBT households have a gun in the home that is loaded and unlocked. Where people own guns varies quite a bit across regions in California, so that in the most densely populated urban areas, gun ownership is much lower. Gun ownership is higher in general in the more rural and suburban counties in the state of California. So now we're looking at information about serious thoughts about suicide in the last year by both LGBTQ status and age. And what we see is that all of the gold bars, which represent LGBT people, are higher than the blue bars, which represent non-LGBT people. And we see this, this disparity across age cohorts, where it's particularly noticeable that about 1 in 4 and 1 in 5 18 to 24-year-olds and 25 to 34-year-olds have thought seriously about committing suicide in the past year. When we look at suicide thoughts across gender, we see that the bar is highest for transgender people of all gender identities. Also high for cisgender women, and of course we see the LGBT, non-LGBTQ inequity across groups, and even for the lowest group, 1 out of 10 cisgender men in the LGBT community have thought about suicide in the past year. So still high even at the lower end. When we look at the same variable across race ethnicity, again, we see for all communities, LGBT people are more likely to say that they have seriously thought about suicide than their non-LGBT peers. We see particularly high rates of suicidal thoughts among people who are Black and LGBTQ and multiracial or other races who are LGBTQ. Our data don't collect information about whether or not people are queer identified, and so sometimes we just use the simple term LGBT, although all of us here, of course, mean to include LGBTQ people when we're thinking about prevention in our work. So intimate partner violence, as I said, impacts all populations. It's somewhat higher for LGBT than non-LGBT people in the past year. When we look specifically at cisgender women, we see that intimate partner violence affects bisexual women in particular. Here's some information about hate crimes in California. There were 2,088 reported hate crimes in the year 2022 in the state of California. 21% of those incidents were attributed to anti-LGBT bias. Now, again, LGBT people are 9% of the state's population, so we see that bias-related incidents are twice as common as the proportion of people in the population who are LGBT themselves. What you're seeing now is information about reported hate crimes against people on the basis of race. And what we see is that there has been a rise in hate crimes. In the news, we saw lots of information about a rise in hate crimes towards Asian people around the COVID-19 pandemic. But what's notable here also, in addition to the anti-Asian hate, is an increase in hate crimes and the particularly high level of increase and elevation in general for hate crimes against Black people in the state of California. And as we noted before, many LGBT people are also people of color. Therefore, when we ask people if they worry about being the victim of gun violence, we see that the gold bars are all longer, which means that more LGBT people than non-LGBT people are worried about gun violence across racial ethnic groups, and that some racial ethnic groups have higher levels of worry in general than others about gun violence. So I'm going to pause here and take a moment to turn the conversation over to Kuko. I'm going to take this slide down, but we can certainly come back to it if folks are interested. Okay, thank you.
Thank you, Kerith. Now we have about 30 minutes. I'm going to, I think you've kind of heard who's on the panel. We have 3 panelists. I'm going to quickly kind of go over some questions. We have about 30 minutes. And also give folks a chance to kind of introduce themselves a little bit more and talk a little bit about the work that they do as well. But what I'm going to do is I'm going to start with some individual questions from Mallory, then Kate, and then Gabriela. And then Mallory, if you can also talk a little bit about, the organization that you work with, that'd be great. But in our prep calls, you talked a little bit about the continuum of violence that's perpetrated on LGBTQ plus communities and its impact. In other words, there's many forms of violence that have significant implications on individuals. And can you elaborate on that, please?
Good afternoon, everyone. Kuko, Kerith, panelists. My name is Mallory Jenna Robinson. My pronouns are she, her, hers. I'm the creator of A Hateful Homicide. It is the only true crime and investigative journalism podcast and YouTube series that focuses on the hate crimes and murders of our transgender, non-binary, non-conforming, intersex, and two-spirit community members in the United States and abroad. The A Hateful Homicide, as well as my transgender empathy trainings, which provides empathetic approaches with connecting with our TGI communities, especially when it comes to gun violence and other types of violence and discrimination. All of these programs came into place in response to the lack of visibility that our trans community members face. When I was looking at the data that was being shared by Kerith, it was heart-aching to know that 156% of our community members in California who are Black, brown, and feeling unsafe and a potential victim of gun violence, but then also add on the layer of being transgender. Imagine being someone who's trans, who is worried about disclosing their gender identity in fear of getting shot, or being in a relationship with someone who knows your gender identity, but is on the flip side afraid that someone's gonna find out that this person's with a trans partner and then kills you in response out of the fear and phobia. So these are things that, as myself, as a Black trans woman, Afro-Caribbean trans woman, for the past 18 years in my truth from youth to adult, I can tell you that it is a real fear. And so that is part of the conversation with the hateful homicide, but it's also part of the conversation that we're gonna have today, especially when we think about our LGBTQ plus community members. I also wanna remind everyone in this space that transgender is a gender identity and not a sexual identity. So for example, someone like myself who identifies as a trans woman can also identify as bisexual. So we still always fall within those different sexual identity spectrums as well, because gender identity is completely separate. So we're still always tying in how ourselves as LGBTQ people show up, especially as trans folks. But I hope that gives you guys a little bit more insight into what I do and why this conversation is important today. Thank you.
Thank you, Mallory. Kate, this question is for you. In terms of mass shootings, How often are they occurring, to LGBTQ plus community members? But additionally, although these incidents might not be super significant in terms of large in size, what impact have automatic weapons have on the implications of this? Because I think that, I think people sometimes look at the total numbers, but they're not looking at the types of weapons that are used. And I think you talked a little bit about that in our conversation.
Yeah, thank you. Well, just to introduce myself first, my name is Kate Reese. I use she, her pronouns, and I'm a researcher at Everytown for Gun Safety. Everytown for Gun Safety is the nation's largest gun violence prevention organization with nearly 11 million supporters of moms, mayors, students, gun owners, faith leaders, educators, artists, activists, and so much more. And on the research team, we're really dedicated to identifying, studying, and advancing evidence-based solutions to gun violence that will save lives. So we've got a team of about 15 researchers with different social science backgrounds, from public health to criminology to sociology and economics. And so to answer your question, I think I first want to talk about the nature of assault weapons. They are absolutely designed to maximize carnage, and it shows in the way that mass shooters have used them. So from 2015 to 2022, the mass shootings in which 4 or more people were killed that involved an assault weapon resulted in nearly 6 times as many people shot, more than twice as many people killed, and 23 times as many people wounded compared to those that did not use an assault weapon. In that same time period, 8 of the 10 deadliest mass shootings, where at least 9 people were killed and 9 people were wounded, involved at least one assault weapon. So while assault weapons are banned in California, they're not banned in the vast majority of states. That's because the federal government let the assault weapons ban lapse. So if you look at a map of which states have assault weapons bans in place, you'll see that none of the states around California have taken sufficient action to restrict these weapons, and that's why federal action is needed here. To the second part about how often mass shootings are happening to LGBTQ plus people, I think we have to start by acknowledging that mass shootings account for less than 1% of gun deaths in the United States. But contrary to the way that we typically think about mass shootings, almost half of mass shootings where 4 or more people were killed were incidents where a shooter was targeting a current or former intimate partner or family member. So while in California, to go back to the information that Kerith was providing, LGBTQ plus adults might not have the same levels of gun ownership. Nationwide, we know that 40% of LGBTQ plus young people reported living in a home with a firearm. And so I think it's really important to connect the risk of domestic, intimate partner, and family violence among LGBTQ plus people to the prevalence of domestic, intimate partner, and family violence in mass shootings. And then more broadly, I just want to echo, I think, what Mallory was saying, which is that mass violence that targets LGBTQ plus people affects us all. The Pulse nightclub shooting and Club Q shooting were high-profile public mass shootings, but the ripple effects extend far, far beyond those immediately impacted. So I think it's just important to think about that continuum of impact from one person to their immediate family, friends and family, to their community, and to people across the country who might live in a very different state, but share an identity with those affected.
Thank you, Kate. And Gabriela, I know that as Kerith talked a little bit about in terms of the data, one of the things that's problematic with the data is it implies that we're collecting it, and sometimes our communities are ignored by not collecting any information. And certainly in this field, that's one of the strategies that I think the opposition looks at is just don't collect the information, therefore they can't be held accountable to that information. But on the ground also, there's I think folks that are doing this work, and I know that you and your organization responded to polls, and there's a lot of things that people don't know. So from your standpoint, in terms of your response to polls, what don't people know about polls that I think is critically important, that isn't in the news or isn't in the data, that I think is important for you to share?
Yeah, first and foremost, thank you for inviting me in today's My name is Gabriela Rodriguez. I use she, her, and a pronouns, and I serve as the executive director of Q Latinx, which is a small grassroots organization in the Central Florida area, as Cuco mentioned, that was started shortly after the Pulse tragedy in 2016, where gunmen came and killed 49 individuals and injured 53 and really left the community in shambles. So our organization exclusively works to empower and advocate for those that sit at the intersection of Latinx and LGBTQ. For those that don't know, Pulse was on a Latinx night. 90% of the individuals that were there identified as Latinx. When it came to barriers to care, there were many. So from language all the way down to being undocumented, to those that had been criminal justice involved and not being able to access needed resources such as victim compensation or other resources in our community. I think something that I would like our community and people to know even after 8 years later is, as I mentioned in another panel that I was part of, is that healing isn't linear, right? I think in the beginning, a lot of folks were like, mira, you need to do this and you need to do that, but it wasn't by or for our voices, right? So we really needed to show up and start asking questions. And as somebody else mentioned, is really creating our own tables. I think we need to remain inquisitive, asking questions, being able to investigate. We have many family and survivors that are still suffering. We need to have an intersectional lens when we're talking about our community members, right? Before we're talking about how they've been affected, we need to also ask if they have food in their mouth, if they have a place to sleep, if they have other resources, really giving an intersectional lens to a lot of these issues, whether it be mental health or community healing initiatives, creating out of the box initiatives, I think is really, really important to be able to even start the conversation. I know in the beginning, we used art as a form of being able to talk to individuals. And then through there, we cultivated trust building relationships and we were able to bring those topics to the forefront, right? Then people were able to talk to us, right? Porque de verdad, we leave, eso se queda en casa. That's the saying that we have. When it comes to things that happen, we leave it at home and kind of that festers, because a lot of us are just trying to survive and make it in this world. And sometimes we don't realize that was a blimp in a lot of people's lives, right? And then they had to continue. They had to get up the next day to go to work, or they had to get up, take care of their kids. And I think some of the solutions that are there are like, pues, we get money and they're good. Oh, I work with many families. I left social work last. I've been 8 years working very inclusively with a lot of these families and survivors, and they're still very much suffering. So we need to make sure that we remember, but we also, instead of, again, those thoughts and prayers, really thinking about the actions that are being made and really talking about policy, I think is really important.
Thank you for that insight, Gabriela. This question will go out, I think, to the 3 panelists, and you can, maybe we'll start with Gabriela since you just closed, you were last. And this question is more related to funding, because a lot of this work is has to be supported. But sometimes, when being a member of the philanthropic sector, sometimes philanthropy, one of the things I struggle with is that we prioritize things that don't line up with the priorities of the community or priorities of the organization. One such example would be, we often fund organizations that have great infrastructure, but horrible relationships with the communities. And not looking at it in the reverse, where communities that are trusted messengers and have community trust organizations that are doing that kind of work, that should be weighed very heavily as a criteria for funding. Instead, what we're looking at is infrastructure things that quite frankly are very easy to fix. To gain the trust of a community is a whole other thing that doesn't happen. Even with enormous amounts of money, you can't buy that really. In many cases, it's stuff that gets built, I think, based on some of the things that you all talked about in terms of working on the ground and connecting with people. So what are some recommendations, or in your perspective, what should we be looking at in terms of funding? What criteria, what areas aren't funders looking at that they should really be looking at in terms of support for this work? And we can start with Gabriela, we'll go to Kate, and then we'll end with Mallory.
Dale. I would be able to say being able to support those out of the box initiatives, right? Like I have so many different programs that were on the ground, whether it be at the barbershop or the laundromat or the grocery store, really being able to fund those and really being able to take those qualitative stories and the storytelling as opposed to numbers. Because sometimes, yes, I think data is super important and we need to build better relationships with philanthropy and with our research, but I think we need to meet at the middle. You don't know how many times every month someone's asking me for a letter of support, and yet they don't even know the history of my organization, right? And I sit here and I'm like, wait, at least take me for a cup of coffee. At least do your homework or your research before you come talk to me. And sometimes I see it as a feather, like, right? So it's really like really build these relationships with these groups, because at the end of the day, like we're the ones that have built these relationships, like you dijiste, Cuco, like, and we've strived for years. And I sit here and sometimes see these larger entities and these organizations that do get a lot of funding trickled in. And I sit here and I'm like, well, damn, I wear so many hats, and sometimes I don't have the ability to capture the data. Sometimes I don't have the ability to do all these other things because we wear so many hats. We're a group of 3. So really being able to lean in on these larger organizations that can mentor us has been essential. We're a grantee of Everytown, and we've built a relationship for the past 5 years. They have really came in and been with us. Like literally they were making buttons. They were coming through when we did our couple of our statements. They were there for June 10th, 11th, 12th, and 13th, right? Like think about us outside of just June, right? 365, we're gay, we're queer, we're here, and we're doing the work. So really building those trusting relationships and doing your homework and vice versa, right? Sometimes from our point of view, being able to do our homework on the other end, but being able to lean in on each other, I think is really important.
Thank you. Kate,
Yeah,
same question to you.
Yeah, I mean, we rely so much on our partnerships with local organizations that are doing work at the grassroots and community level. And it's been said on this call, but having relationships in place with people is the best way to ensure that research can be done from an equitable and honestly just caring lens, right? Like we care about people, and there are ways to structure qualitative data collection in a way that reflects that care. And so I think that that's something that's top of mind. You know, the other thing that I think about is like, I'm really interested in research and expanding leadership opportunity for LGBTQ plus youth. I think that there is great potential to support programs that allow young people to step into their power and become the authors of their own story, and equip them with the resources and tools and acknowledge the authority that they already have in order to sort of make change in their community. So that's the other way that I kind of see philanthropy meeting sort of from the grassroots and also getting support from the top down. So.
Thank you. Mallory?
Of course, absolutely. I would definitely say for myself personally, just thinking of a hateful homicide, we are a grassroots, like just locally ran, very like small, organized brand organization. So I would say one of the things I've noticed when it comes to funding, especially on a federal level, is that, a lot of times they want you to have a 501c3 or they want you to have other certain criteria. And I would urge everyone to do their due diligence and break beyond those barriers, right? Like be willing to, it's like what Kate said, be willing to invest in those people who have those passion projects, who are willing to make those dreams into a reality, and be willing to invest in them. And then believe, and then also, right, this is where we can do the part in creating, like programs, mentorship programs, to get those single, individuals who are doing the work, right, who wants that funding, just like any nonprofit would as well. But we can also show them how to become a nonprofit, right? While we're making them a sub-grantee, while we're giving them those mentorship skills, so that way they can continue to be their own leaders and bosses. So those are the things that I would echo. In response to that, especially depending on what the grant is prioritizing, especially if it is prioritizing gun safety, making sure that those who are going to come into this funding really has some type of understanding, or also being willing to provide understanding to those who are interested. We all come from different lenses. And so sometimes, you know, you may have someone who, like myself, I have a science lens as well, and I may not know much about gun safety, or, you know, but I want to get into that passion because of instances like Pulse, because of Sandy Hook, because of Malaysia Booker, right? The trans woman who was murdered for simply speaking her truth on national television in 2019, Black trans woman. So we want to be able to do our due diligence and make sure that we're uplifting folks no matter what lens they're coming from. And so that's what I urge and encourage everyone to do, is we want to be open to that. Support your individuals who are trying to do the work. Give them the tools and trainings, right? Include that in that process. And then also just be willing to, you know, continue to teach them what may be something that they don't know that can be useful to a new skill set for them. So thank you.
Thank you for that. I also want to let the audience know if we're getting close kind of to the end of some of the set questions that we have, but we also want to give folks an opportunity to ask questions. So if you see any, if you can go to either the chat or the Q&A and add your questions, be more than happy. Hopefully we'll get to those as soon as we're done here. You know, one additional question for everybody is, you know, what are the byproducts or consequences of sustained violence that's perpetrated on LGBTQ plus communities? It's not just the extreme we're talking about, firearm violence and shootings, but there's a lot of other forms. There's a spectrum of violence that occurs, from narratives to everything, what we see on a daily basis. What's the impact of that? What's the net impact, and what are you seeing that I think is important for people to understand? And we'll start with Mallory, and then we'll go to Kate, and then we'll go back to Gabriela.
Absolutely. Thank you, Kuko. I will definitely say, to share a little fun fact, I am getting ready to be in a play that actually talks about violence in Los Angeles. And so one of the parts that I have in this play is where I talk about the number of deaths of our LGBTQ plus community members since 2017. So this would have been about maybe 9 months after polls when this data would have been collected. But what you saw from 2017, circa 2017 to present day, is that 263 trans folks, gender nonconforming, non-binary, intersex, and two-spirit Indigenous folks have been murdered for simply being in their truth. And 50% of that number reflects someone like myself, an Afro-Caribbean Black trans woman. And a lot of this is coming from, because the reality is and I'm going to go into these kind of like spectrums here, and I want you all to follow me. When we are growing up, especially as millennials, young people, and even those who have been around millennials, right? We grew up in a generation of video games. So let's start there. The fact that we have a lot of community members who have utilized video games as a source of coping and community. When a lot of those video games, or some of those video games, have gun violence, gang violence, and then you channel that into intersectionalities based on your communities. For example, I come from a lens with 4 Black brothers. So not only did they have video games that was teaching them violence, but then on top of that, growing in a single family home, and then trying to still fit in outside of community, outside of the home, playing video games that had gun violence. They were also then placed into other spaces of violence, right? Oh, be cool by doing this, having a gun. And the reality is that there's no education, formal education in schools, right? Again, as a millennial growing up, we didn't have really conversations around like gun safety. We had, don't say, you know, just say no. But there was really no conversations around like, what do you do if you see an active shooter? What do you do if someone wants you to get into a gang and you have to go and shoot the next person that you see? These are conversations that still haven't been conversed. And when we think of all of that, and these are just a couple of things that I'm bringing up along the multitude that I'm sure Gabriela and Kate will touch on as well. But when we think of just those 2 spectrums right there, you channel that, or as long as even if you're not a kid who's from the urban street, even if we go back 25 years to Columbine, and we look at all these kids, right, who have utilized video games and other sources of ways to channel their way of being enraged, we've seen this impact that has really caused an epidemic for our community members, whether it's gang violence, whether it's active school shootings. As a former teacher myself, I've seen the fact that that we've had to know what it's like to have gun safety drills, and all these things are really important when we think about like how we continue to raise awareness around gun violence. We have to have those conversations. We have to have formal education, and it has to start in the school systems. It has to start with our youth and young people. so that way we can make sure that we continue to be the change we want to see. Thank you.
Thank you, Mallory. Kate?
Yeah, I mean, I think, you know, one of the things that I hear Mallory talking about is how these various layers of culturally violent norms and systemic violence that's in place in educational institutions and housing policy, and all these ways that these things that structure our life result in the very like individual impact of someone being shot and wounded or shot and killed. And you know, we live in a nation of gun violence survivors. 58% of adults in the United States report that they are someone that they have cared for, have experienced gun violence in their lifetime. And the trauma doesn't go away when a wound is healed or an incident is over. People who are impacted by gun violence go on to navigate the harm from that for the rest of their lives. 1 in 3 we have a survivor network. We did a survey of them, and 1 in 3 of the LGBTQ plus survivors in that network said that they felt unsafe persistently after their experience. So obviously victims of gun violence can, you know, navigate immense financial hardship and ongoing psychological harm. But there is also this compounding pain that, as I said earlier, ripples through whole communities and really affects mental health. You know, we recently worked with the Trevor Project on a research brief to understand the relationship between firearm project, mass shootings, and suicide risk among LGBTQ plus young people. Yeah, shout out Trevor Project, they do great work. And young people, LGBTQ plus young people who were frequently worried about a mass shooting in their community reported higher rates of having seriously considered suicide in the past year compared to their peers who were not thinking about mass shootings. And so again, the impacts of gun violence extend from, you know, grief after someone is shot, the process of healing after gun injuries, continuing to live in fear of another, you know, incident of victimization. And then there are genuine mental health implications to all this trauma. And again, while this is incredibly daunting and saddening, I think that because there are so many layers to understand where this harm and violence comes into people's lives, there's also lots of intervention points. And there are solutions that, again, ladder up from how we're educating people about storage in their home to what schools can do, especially for queer youth, queer and trans youth, to help them feel supported and safe. To, again, local, state level, and federal policies. We need it all. And so that is perhaps my like rosy lens interpretation of all these really, really hard facts to grapple with.
Thank you, Kate. Gabriela?
I think to say that the impact of gun violence is long lasting and it's intergenerational, right? So we have to really root it back to our ancestors, right? And really talk to our families intergenerationally about what this looks like. As a caregiver, I recently had the opportunity to spend with Moms Demand Action, and that was quite an impactful experience for me as a caregiver with my children having active assailant drills. That's something that even as a gun violence prevention advocate, it's hard for me to talk about, right? It's hard for me to talk about with my kids when it comes to their video games and exposure and stuff like that. So really cultivating those relationships, I think, are really, really important. But I think we have to start at the root. I think we have to start with those conversations with our tias and our abuelas and our tios first, so we can open up the space, right? And then through that, then we can build.
Thank you. Thank you. And I'll go to Kate, and then we'll go to back to Gabriela, and then Mallory. I think we have time for one last question. And that would be, you know, kind of moving forward, where do you see this work like being focused on? What should we be focused on, especially in terms of you know, potential successes or areas that are being missed, gaps from your standpoint? If you had to pick like one area that's a major priority that we should look at, what do you think that would be?
I mean, I think that, you know, one of the challenges that we're faced with constantly, and we've talked a little about this, is sort of poor data in this area. And so I think the path forward is to look at the really great research that's already being done that focuses on qualitative data, survey data, and again, centers the voice and experiences of LGBTQ plus communities. I know I talked about the Trevor Project, but we've also been able to support work being done at the local level in Philadelphia through a lesbian health fund grant to try and understand how people navigate healing after they've been involved in intimate partner violence. And I think those are just some examples of how broadening the kind of research that we allow to sit in our evidence base is going to make the solutions more impactful. And again, demonstrate that care that I think is so important in everything that we're doing. And yeah, I mean, I feel like this panel, I'm learning a lot. And so even just opportunities to be in community with other folks who are in this space, I think is a great win.
Thank you. Mallory, where should we be focused moving forward in terms of opportunities or gaps in services, those types of things? What do you think?
Absolutely. Everyone's sentiments I echo, but definitely in addition to that, I want to add that we must, and I appreciate what you all are doing with highlighting LGBTQ gun violence. Let's also continue to center and prioritize. And I'm speaking from a lens where just because there's 26 states right now where there's anti-trans legislation, which includes like stand your ground laws, that pretty much says that someone can, shoot you. And so we've had cases of trans folks, a hateful homicide. My podcast, that's something I would encourage you all to definitely please take a listen to, check out, really learn about the trans community, right? We're more than just a headline of, oh, guy dressing as a girl found slain because they didn't tell the person who they were, right? That's not our narratives. So we're much more than that. And I urge each and every one of you to take a listen, invest. Human Rights Campaign, Transgrio, these are other two organizations that are also centering work on like making sure that people are understanding the crises that are happening for our trans community members, and not just in California and Los Angeles County, but also on a global impact, especially in countries that are hugely impacted, such as Uganda, Haiti, and where my ancestors come from as well. There's a huge, heavy impact on like trans violence, gun violence specifically, as well as knife violence, which is a whole nother conversation for another time. But these are the conversations I would, and just also the areas of growth. I like to encourage everyone to please just, please connect with me as well. I'm an open book. I'll be glad to bring you all into an episode. Let's figure out how we can continue to raise awareness, but also collaboratively on the flip side. As a community member of the trans experience, I wanted to have that empathetic lens and say, let me know as well how we can support you all too, because this is a fight for all of us. Gun violence is a human race issue and not just a specific person issue. So thank you for your time. And that's just pretty much what I have for you all in terms of what you can do to support.
Thank you, Mallory. And just a reminder to folks out there, if there are any funders as well, please support Mallory's work, especially her podcast, The Hateful Homicide. I'm sure, a lot of what we're talking about here is support for the work that sometimes funders don't recognize because they're focused on these other larger areas. So Gabriela, to you, the same question in terms of what you see kind of moving forward as potential opportunities or also gaps that we need to focus on.
Yeah, I think opportunities for funders is really invest and be willing to get down and dirty with the organizations that you're funding, right? Really learn who they are and what they do. I recently had the opportunity to have two funders that did reports literally while we were sitting across from each other, as opposed to writing a narrative. I'm someone that's neurodiverse, so it's really important for me to have different ways to be able to submit things, different ways for me to be able to receive a grant or have a conversation with an individual. So I think being able to think again out of the box. I would also say, damn, I lost my train of thought and it was a good one.
Okay.
No,
Well,
it'll come back to me.
Thank you. So I think that wraps up kind of our set questions, but I wanted to open it up, I think, to folks. And there is one question that's on here, but I think that may be something, I think, Jen, your question is, we know that there are significant disparities by sex and gender in who is perpetrating firearm violence and who's being killed or injured by firearms. Does the CHIS data speak to disparities at the intersection of sex, gender, and sexuality? That's one of the questions that's on there, and I don't know, Kerith, if that's something you want to entertain here in the the next 10 minutes, or is that something that maybe when we do the breakouts, it might be a better forum to respond to that in terms of the data?
The GIST data, I can answer it quickly, don't gather information about who's perpetrating or who is a victim of gun violence. But I want to pass it to Kate in terms of data sources that you might have through every stat.
Yeah. So we, in the gun violence prevention space and at Everytown, have really worked hard to make data available in an easy to use way in order to understand racial disparities and disparities along gender lines. So I'm going to plug our website, EveryStat, which puts together firearm fatality and injury data, as well as economic cost estimates, and provides it at the national, state, and even county level. So it's a really great advocacy tool. You can see how your state ranks nationally in overall gun violence. You can look at the rate of change in gun violence over the past decade, proportion of gun deaths by intent, again, racial disparities, gender disparities, and the impact on gun violence on children and teens. And it has a very cool feature where you can download and print individual PDFs for each state. So again, just highly recommend it as a tool to explore. And I think the CHIS data we'll probably get into in the breakout.
One other point that I hope most folks on the webinar know is that death certificates, which are a really important source of information about causes of death, don't uniformly, in fact, rarely collect information that would help identify if folks are transgender or cisgender and people's sexual orientation, which means we don't know a whole lot about what's killing LGBTQ people. And this is a big gap we need to fill. We're fortunate that John Blaznik will be joining us in the research breakout group. He and Ann Haas have been doing lots of great work to make sure that we're counted even at death in mortality records. So hope you can join us for that.
Thank you. There's another question here. Although this would not curtail mass shootings, but in terms of educational outreach regarding gun safety, gun use, gun family talk, and gun self-defense, in addition to external awareness, what has been implemented? And I mean, I can tell you in terms of our work, that's a broader kind of gun violence question. There are some organizations I know, Everytown, I know Brady and Gifford's, even us, a lot of us are trying to focus our work on, the importance of gun safety, gun storage, those types of things. But outside of that, I think nationally across systems, which is really important, especially schools, what you're seeing consistently is shooter drills. You're not really focused conversations on the safety issue or the access issue in terms of not only violence to others, but violence to self. And so those are all areas that I think we're focused on. But I think in terms of the question, unfortunately, there has not been a concerted effort to consistently create strategies across the country that are embedded in systems that are trying to address this issue. Mallory, you have your hand up.
Yes, I just wanted to also add as well, one of the things that I've noticed, especially in the advocacy work that's being done in Los Angeles County, is we have these defense classes for our trans community members. Shout out to the Trans Defense Fund LA. They're also a community-based individual organization that receives donations, so definitely support their work, but they provide safety defense kits and also safety defense courses on like how to combat yourself. Like if someone comes up and tries to rob you at gunpoint, like how you can try to like unarm them and keep yourself safe. So all of these conversations are super important and pivotal in the work that's being done. And I just wanted to add that really quickly.
Thank you. And Gabriela, I think you also want to respond to that. And so does Kate.
Yeah. Yeah, same with us. We are actually going to be hosting in July a queer self-defense class. It's going to be a 3-day series where the first one we're going to be talking about de-escalation. The second day will be tactical. And then the third day will be a gun safety class along with range time that will then go on monthly, and then it'll repeat itself again. We've also are implementing different listening sessions with different groups, whether it be our BIPOC community, our veterans, our kids, and our teachers. So then from those, we'll be able to create strategies that we can move forward with. And then I just came through with my thought that I had from beforehand, and the thing was visibility. There's so many times that we are the only queer folks in the room, so making sure that you continue inviting us into spaces and that we're really a part of intentional conversations, whether it's building or creating various conversations to continue. Thank you.
Yeah, and I just
Hey.
wanted to speak briefly about Everytown's B-SPART program, which provides parents, educators, community members with resources to understand secure storage and why it matters for reducing gun violence. And actually, there are school districts around the country that have passed resolutions to send home information around secure storage as a form of gun violence prevention. And Los Angeles County and San Diego are two of those school districts. So some movement there, which is pretty incredible.
Great. Thank you. Thank you very much. I think I will turn it over now to Kerith, are you going to kind of transition us into kind of the breakout groups, or Tiffany? I want to make sure. I know Tiffany's not feeling very good. But thank you, Tiffany, for all your support and all your help.
Thank you, Kuko, and thank you, everybody on the panel. We put together as a group some recommendations for those of you attending the webinar about how to prevent gun violence. We need to work on reducing animus towards LGBTQ people, as well as racism. We need to increase supports for LGBTQ youth. That means making sure that school is safe and home is safe. Suicide risk is increased dramatically by exposure to violence and harassment. So if we can reduce exposure to violence and harassment, we're going to do a lot to reduce suicidal ideation and suicide attempts. Economic vulnerability puts people at risk of violence, particularly from intimate partners. So hire trans people. That is one way to help keep people safe. We see higher rates of poverty, higher rates of underemployment and unemployment for trans folks. So hire trans folks. We need to make sure that everyone has access to healthcare and basic necessities, regardless of citizenship status. The state of California has expanded healthcare coverage to all people, regardless of whether they are documented U.S.-born citizens or here with legal residency. So it is possible states can take these actions. And when you have access to healthcare, it means that you can get screened, engage in regular mental health screening. And if folks around you are aware that you are having challenges, can refer you to health providers to get screening and get triaged to support. We also need to make sure that we are collecting data about gun ownership and safe storage practices in publicly funded surveys. Several of us had to raise money through a grant to collect the data that were presented today. We need these data collection practices to be funded by the federal government and by states because it is an important public health issue to make sure that the public is safe. We need to identify LGBTQ people on death certificates. And I thank all of you who are working to improve data collection, as well as all of you who are working to make communities safe and to support communities who have been exposed to gun violence. So Gabriela and Mallory, Kate, Hugo, I just want to thank you all so much for sharing your expertise and yourselves with me and with the rest of us today. For folks who would like to join us for our breakout sessions, you can click on the link that's in the chat. Make sure you click on it before you exit out, otherwise you will lose that opportunity to see the link. For those of you who are joining us just for the panel, thank you for being with us. Thank you to the UCLA Center for Health Policy Research for all the work they've done over decades to make CHIS possible. Thank you to my collaborators, Sean Sean Tan. Thank you to Nina Esponce for her great work as the PI of our gun violence grant. All right, thank you.